I'm Michelle Cody. I'm going to start sharing my screen so I could bring up this first slide. And all right, so here we go. So while we're welcoming everybody in, I know people are making their way through different rooms. This is the Telecollaboration track, and we have several of our IPTI teams here today. And so we'd like to start this off during this transition time with just a quick quote from one of our alumni that spoke about the value of IPE in their education here at UNE. And now they work in a clinical setting. So again, I'd like to welcome everybody. And with me today, like I said, I'm Michelle Cody. I work with CECE. And with me today, I have Sarah Garber from Rosalind Franklin University. And she'll be here to help answer questions and get the conversation going after this presentation. So this first presentation we have, here's the poster. It's about connection, lessons from interprofessional immersion. And so if any of the team members on this presentation are here today, if you want to give a wave here on screen so people can see who you are, welcome and thank you for participating in this presentation. And now we'll show your video.
Hello everyone, my name is Jillian Batista and I'm a third-year Doctor of Physical Therapy student at UNE. This semester, myself and multiple other disciplines participated in interprofessional team immersion. My team consisted of social work, occupational therapy, osteopathic medicine, allopathic medicine, physician assistant, and physical therapy. Our client was Amanda, who presented with long COVID. Amanda was hospitalized for 11 days and shortly after was discharged from the hospital and began experiencing excessive fatigue, cough, brain fog, short of breath, hair loss, loss of taste and smell, and debilitating migraine headaches. Our team goal was to work with one another to learn more about Amanda's circumstances and make recommendations for the next step in her care. This immersion allowed each of us to gain a better understanding of each other's professional roles, develop better collaboration skills, and to provide the best care to our patient. A main takeaway was learning how to work through trial and error with a variety of different skill sets. Below, we listed what we took away from this experience, our challenges and how we address them, and the pros and cons of telehealth. In addition, there's comments on the right side of our poster, and that gives you a brief statement from each discipline about what they took away from this experience. Thank you.
All right, everybody. So that was their presentation. We have a couple of minutes here to have some conversation and reflections. And if any of the presenters that were part of this, if you'd like to elaborate or speak more about your presentation, you have the floor.
Yeah, so just kind of touch on what I also said in the video. We just did the interprofessional team immersion and we came together, I want to say maybe 7 times, and just planned how we are going to best care for our patient. And it was really nice. I think at first everyone was a little bit nervous and kind of hesitant, but once we started explaining what each discipline did and how we can help, I think really opened the doors, and it was a really great experience.
Thanks, Jillian. I can ask a quick question. What do you think was the most important characteristic in bringing everybody together to work on the same page?
I think communication. I think there is hesitancy of what we wanted to say and what we wanted to do, but we wanted to make sure that we were respecting each other's discipline. So I think just being respectful and communicating was a big thing for our group. I don't know, Dave, if you have anything to add there.
Yeah, with different, slightly overlapping professions coming together, one of the challenges was when we had a slight misalignment of perspective on what might be the best way to go forward or who might be the best person to go forward with it. Being able to work that out interprofessionally to say, all right, this is the consensus that we're forming, and this is the person who should best spearhead this part of patient care, client care. That was definitely a skill set that we developed. And then in presenting our different perspectives on client care to the clients, having kind of central voices that would come through each one of the different meetings so that they wouldn't just have a whole new group of faces every single time, that they had at least 1 or 2 people who would be there in each of the meetings, say, all right, we're going to introduce the new specialists that are coming in this week. We're going to be sure that your questions get back not just to the 4 people here that you're asking it to, but to everyone kind of behind the scenes. And having that kind of central thread running through each of the different appointments with our client seemed also really to put our client at ease and help facilitate getting communication both directions to the group and from the group, in addition to those professionals who could make it to a given meeting.
All right, we have Mike Sheldon has his hand up with a question.
Yeah, this is maybe a follow-up to what David just said, but I'm kind of curious in this realm. Obviously, long COVID is a new term, and I've heard some recent discussions that there are different forms of long COVID, and probably now trying to tease out sort of the different presentations in that realm. And I am kind of curious how you decided on a consistent communication plan when literally you all were learning in real time as well, right? Trying to keep up with all the contemporary information that was coming out, false information, parsing through, information that was incorrect versus, really trying to provide the patient the best information at the time, and how you all coordinated that.
Yeah, I can speak to that just briefly. We didn't have any particularly strident disagreements, so we had a whole lot of good intellectual questioning where we asked, all right, what is the best way forward? I think this might be this particular way. And others saying like, okay, from my background as an osteopath, as a physician, as whatever it happened to be, they would be able to share there. And thankfully, we didn't have any such strong opinions that there became a clashing of professions. So I'm certain that in further repetitions of this with other groups, that would be inevitable. But in our limited experience, we didn't really have very much of that. And to your point, Mike, about a lot of this information being very new, we did a fair amount of research on our own and then try to find our own answers and bring it to the group for the next set of meetings. One of the challenges we had there was having two, sample appointments in one evening. We only had a few minutes in between, the first appointment and the second to do anything more than just kind of catch our breath and run ideas past each other. So in a more real world version of that, we would have definitely had more time to look up that information, which could have maybe led to other answers too. But thankfully, we didn't really have any strident clashes of professional doctrine perspectives or a jurisdiction.
And sorry, I know we have other questions in the chat, but I think we've got to transition to our next presentation here. So everybody either hang tight, or if you want to navigate to another room, feel free to do that in this next minute. All right, welcome everybody. If you're just joining us in the telecollaboration track, we're on to our next presentation. And here's the poster. And if any of the presenters are here with us today, if you want to give a wave. And I'm Michelle Cody. I work in the CECE office, and I have Sarah Garber with me, who's my faculty friend here. She's from Rosalind Franklin University, so she'll be able to help with facilitating Q&A today. Here's the video.
We'll be presenting United Plan of Care, Interprofessional Approach to Long COVID through Telehealth. The students involved are Elizabeth Bocal, Annalise DePaulo, Aaron Fatima, Nicholas Goodrich, Brenna Keefe, Anna Marianishvili, Cam Tai, supervised by Sarah Garber. Purpose of the study is to examine diverse perspectives with which each member of the interprofessional healthcare team assesses the care study of long COVID. History of present illness: 39-year-old female hospitalized for 11 days for a diagnosis of COVID. While admitted, she was placed in the ICU and intubated due to significant drop in her O2 levels. Since leaving the hospital, she has experienced excessive fatigue, cough, brain fog, shortness of breath, with and without exertion, hair loss, loss of smell and taste, and debilitating migraines. Due to physical and mental toll of long COVID, she has not been able to return to work as a sales clerk at Home Depot, where she works with her husband, M. Medications she takes are lisinopril, albuterol inhaler, multivitamins. Her vitals are elevated: BP 138/72, heart rate is at 92, which is elevated, respiratory rate elevated at 25, O2 stat is a little bit low at 95%, temperature is normal at 98.7, and pain at worst is a 6 out of 10, but right now is a 4 out of 10. I will popcorn it over to my colleague.
Thank you so much, Anna. So as you can tell, this case was very complex, and I'd like to share on behalf of my team a quote from our patient. She says, "I guess it's just really hard to cope, and it's just been a lot for the family. Again, like I said, I haven't been myself, and it's just been hard on the boys and hard on my partner, M. I haven't really talked to anyone about it. I just feel like right now I'm just barely getting through the day, that's all I'm doing. That's all I'm doing." This was shared by our patient, a 39-year-old female who's dealing with the effects of long haul COVID. As a group, a common overarching consensus reached was the importance of this collaborative approach and knowledge of roles while we were acting in this interdisciplinary setting, even though it was a simulation. While working with a client over telehealth in Zoom, it was really important for us to know the patient and keep this interaction fluid. Even though most of us are type A and wanted to go in with our own agendas and questions for the best care possible, we really had to let the patient guide the process and radically listen. So each profession offers this unique approach and point of view to contribute to patient care and to achieve the very best patient outcomes. But when we work together, the different professions serve to help shape our view of the whole patient. Being conscientious of the limited access to healthcare and health maintenance over the whole process, especially in rural care, we knew that we had to come together for this multi-pronged approach. And as you can tell in our poster, the title, this United Plan of Care, it's really important that we work together, and we hope that you can tell this from our approach and our objective.
All right, I am going to now pass it over to Sarah Garber, because this was your team, Sarah. So did you want to lead the conversation from here?
Sure. I know there's several people here from the team, and I would like to ask the team what they found the most surprising about this interaction, the simulation. How did it affect them and their approach to thinking about practice? Clinical practice?
Yeah, I can speak to that. I think from pharmacy's perspective, you look at the medications, you look at the past medical history, and you don't necessarily always think about the emotional side that you can see when you're talking to the patient. And that was very prevalent in this case. So I think that was the biggest surprise for me.
As I said in the video, I think about the whole patient pretty regularly, especially as I have had and still care for an aging parent. And I think the complexity of this case, although Amanda was not aging, really indicated the need for all of us to work together. I know that you were so important in helping us reframe our thoughts sometimes when we would get into our silos of wanting to ask specific questions and be a little bit more relaxed about going in without a plan or being able to pivot. And so I really appreciated that I'm going to use the term maybe like reflexology of that approach. And so I'll take away from this experience being able to be a little bit more reflexive in my approach to practice. And that was incredibly practical and helpful in just approaching the situation.
Well, thank you both. Good insights. There was a hand up maybe, or was that?
Me?
Yeah, Shelley.
So my question has to do with the fact that we don't really know a lot about long COVID. We don't know how to treat it. It's something, many of us come into the professions wanting to really help and fix a problem. What was it like as a team to be dealing with something that, you had some ideas about, but you really didn't have, a case book to work from to say, oh, this medication or this particular treatment modality?
I would say from the OT perspective that we really wanted to try and figure out what was most important to the client. So trying to understand what their short and long-term goals may be and see what collaboratively we could work on together to try and address those needs so then they can make the experience more beneficial.
I can say as a facilitator, it was interesting watching everybody deal with the area of gray that we were in. It's an uncomfortable feeling, but the team worked pretty well through it. There's a question from the chat. And how did your experiences with this project improve communication and teamwork, or your approach to communication and teamwork? And how will you plan to take that forward into your professional practice?
So I noticed that, Nicholas, were you trying to respond to the previous question, or because I just noticed that, if that's all right, Sarah?
We only have a few
I'm glad you noticed it. I didn't.
Yeah. So for that question, I think we focused a lot on symptom management and trying to make the quality of life for the patient better. That was where a lot of our focus was spent. So we mostly went off of what the patient, like we talked about earlier, what the patient was want to do to improve quality of life.
All right, we're going to have to pause it here because we're ready to go into our next presentation. So feel free to either sit tight and hang out for the rest of these presentations in telecollaboration or navigate to another presentation if you'd like to. Welcome, everybody. You're probably settling in. We're in the telecollaboration track. And here's a quote from one of our UNE alumni speaking on their experience of learning about IPE during their time at UNE before stepping into a clinical setting. So now we have our next presentation, which is the many consequences of long-term COVID, a team effort. And so if any of the presenters are here with us, we welcome you to wave your hand and indicate that you're here. I see Carrie, Cassie, and Alec. If you're here as well, feel free to wave your hand. Here is their poster. And then we'll share their video.
So hi, my name is Carrie Brown and I'm in the osteopathic medical school. There's Cassie Brandow in the OT school and Alec Daigle in dentistry medicine. We worked together on a project with a simulated patient who had long COVID. The name of our poster is The Many Consequences of Long-Term COVID, a Team Effort. This poster discusses the many possible consequences of long COVID and how our team approach was used to provide treatment to our patient. Our team included a variety of professions and engaged through a telehealth platform in a simulated case.
Our team began by introducing our different disciplines and sharing which aspects of the case we would like to know more about. Our team included dentists, occupational therapists, physician assistants, doctor of osteopathic medicine, pharmacy, and social work. Through collaboration and communication, our team fostered a comprehensive plan of our expectations for each of our client interactions. Through the course of the interactions with our clients, we included the following interventions: medication changes, energy reduction techniques, migraine management, education on work resources, and other additional family resources.
We came up with 3 goals of team-based healthcare. The first being communication. We think there's a problem in healthcare that can lead to repetitive tests and decreased efficiency. The second goal was define roles. This is so every provider feels valued and is using their skill set to the greatest extent. This can also stop overlap between providers giving the same patient care and can increase the team efficiency. The last is a shared goal. This is to make sure every provider is working on the same goal, and this can make the team much more effective. We learned about the ongoing battle patients have with long COVID and how prevalent it can be in the population. We learned how extremely effective team-based healthcare can be. And we also learned about the other healthcare professions and how to communicate effectively. We would like to acknowledge Dr. Mayer, Dr. Afrat, and Professor Crampsey for their mentorship and the IPTI program for this event.
All right. So I would now like to pass it over to Sarah Garber. I don't know if Sarah, if that sprung up any questions for you or conversation points, or if any of the other team members would like to speak here. Sarah, go ahead. Sorry.
I'm going to pull something from the chat because there are questions there that we haven't been able to get out there. So one of the questions in the chat is, what was it like to come together quickly as a care team in such a complex case? And how do you think about transferring what you learned to professional practice?
I can answer that one briefly. I think as we worked together, we all learned that we had very similar, we all cared about the patient and we had very similar symptoms that we had concerns with. And so a lot of us were concerned about the client's ability to work in her home environment, with the amount of fatigue that she was experiencing, her migraines, how her experience at the hospital was. We all had a lot of similar takes. And so I think learning, at least for me, I learned a lot about how the other professions like work with the patient and what they're looking for. And so when I'm in my own practice and I'm having that conversation with the physician assistant or with the pharmacist, then I have like a better idea of what kind of questions to ask them and kind of what their perspective is to make sure we have a better collaborative experience when making the best care for our patients.
Yeah, I'll just add that I learned a lot about the other professions and what their roles were. And as like a hopefully future DO, I can feel like more confident about sending referrals to like occupational therapy or checking in with pharmacy and just communicating better from their perspective. I think it was a really valuable experience in that aspect.
How was it to deal with a case like this where you really didn't have that much information and we don't know that much about this particular condition? How did that affect your teamwork?
I think we really had to rely on each other and each other's knowledge. So we may not know a whole lot about COVID, but there is research that each of the disciplines have about ways that we can help. So for example, we had the opportunity to work with a social worker, and she had a lot of information and a lot of awesome resources that the family could use during this time. Our pharmacy individual did a lot of research on alternate medications due to some adverse effects that she was having. And then as us as occupational therapists, we talked a lot about fatigue and some of her migraine symptoms that she was experiencing. So although we may not know a lot about COVID, we found that as working as a team, there was a lot of things that we could do to provide relief and answers for our client when we were working together.
Yeah, and just to, continue that stream of thought is that one person can have so much information, but when you have 5 people working together who can collaborate together and communicate well, you can get like 5 times as much information about COVID because there is so much information. I mean, I'm going to be looking at the scientific stuff versus the social worker is going to be looking at resources for that patient. So it's definitely good for that as well.
Great, thank you. I think we are just about to swap over again, aren't we? Okay,
yes,
thank you so much.
Absolutely. Yep. So thank you all so much. So if you guys want to stay in the telecollaboration track, feel free to hang tight. Or if you'd like to navigate to another session, we also have the leadership and scholarship tracks that you're welcome to navigate to if you'd like. So we'll see you again in a second here. All right. So welcome everybody. We are on the telecollaboration track. And here's a quote from one of our UNE graduates who is speaking to their experience with IPE in their clinical setting and how they were able to learn the values of teamwork and collaboration during their time here at UNE. And our next presentation is an interprofessional approach to long COVID, a glimpse into motivational interviewing and long-term pain management. And if any of the presenters are here today, feel free to wave your hands to indicate that you're here. I'm sure you'll get some opportunities to answer some questions after this.
Okay, our poster is entitled An Interprofessional Approach to Long COVID, a glimpse into motivational interviewing and long-term pain management. I'm Jake McHugh, a PA student. On my team is Ali Kirker, an OT student, Sneha Patel, a PA student, and Zainab Jabor, a PharmD student. To just introduce our subject, it's about long COVID. It's something that about 23% of people experience after they experience an acute episode of COVID. The symptoms of long COVID can be very nonspecific, including headache, migraine, and fatigue. It's not very well understood, and some patients can experience isolation and depression and anxiety. Our patient was one of these people experiencing these symptoms, and she was also having some dyspnea on exertion and other emotional problems as well. So we met with her over a series of telehealth appointments and got to know her a little bit better and came up with some interventions to share with her, which Ali's going to speak more about.
And so some of the clinical interventions that we were able to introduce to our patient during our second session address fatigue management. So we showed her how to use a Google Chrome extension called Dark Mode, which allows everything in your browser to change to darker colors to help improve with eye fatigue. And then we also introduced an extension called Visor, which allows you to highlight smaller sections on your window in order to have a more focused reading experience. We also addressed some pain management interventions, including stress reduction was a big one for our client. and also ways to improve sleep, diet, exercise as well.
So some non-pharmacological pain managements were incorporated. This where we can look at lifestyle interventions or cognitive behavioral therapy changes. We could have focused on improving sleep, diet, or exercise habits. We could have also intervented with some medications like steroids that some patients found helpful, including more stress-reducing activities, Botox injections, while also having more connections with other patients that are long COVID. Things like meditation and acupuncture will also be helpful.
So some of our conclusions from this experience were the importance of building rapport with our patient was super important through active listening, validating the patient's experience, and just respecting their own understanding of their illness and coming into it with an open mind. And we'd like to acknowledge and thank the UNE Center for Excellence in Collaborative Education for bringing our team together.
All right. So what a great presentation. Thank you, team, for sharing that. I know motivational interviewing is a very fascinating and very important topic. So I will pass it over to Sarah Garber from Rosalind Franklin University. So feel free, Sarah, to lead the conversation in any Q&A.
Great presentation. A question about, did you have any conflicts or sort of a little friction between any of the different professions as you were trying to work through this particular case? What was the most important thing to pull yourselves together as a team?
I can speak to that. One thing we actually talked about after the fact is that we thought we all worked pretty well as a team together. One thing I would say that we kind of struggled with initially was the rapport building and maybe not initially addressing some of the kind of psychosocial and emotional experiences that she was having and validating those. We didn't have a social worker on our team, so I think we all kind of had to kind of expand our roles a little bit, think more about motivational interviewing and kind of branch out into some of those areas that maybe we weren't as familiar with. I wasn't. But as a result, I was able to, I did some reading and learning about motivational interviewing after the initial session because I wanted to be able to build a better rapport with the patient. And so I would say that was something that we all kind of agreed on, was just being able to build that rapport was super important going forward. But I actually thought we all worked pretty well as a team.
Yeah, and with that, I think we also kind of right off the bat recognized that what our patient really wanted was to just be heard and listened to. And I think, fortunately, all of our personalities combined were able to cater to that. And in doing that, we were able to find some solutions that might help her, but also just be honest with her and with each other and what we were able to do for her.
Great insights. Mike, you have your hand up?
Yeah, I guess it's just a follow-up question to that response. So you said that for some of you, this was a new technique or a new method of approaching, interviewing. So tell me the big take home about what's going to change for all of you, moving forward as it relates to something that you're just more conscious of as you're working with clients. There's actually questions I'd ask differently, or there's new things that I would add. I'm kind of curious about that part of all of this that you collectively came home with is like big take homes, and wondering, what that looked like for you.
I think I'll speak to this a little bit, but I think the major thing that I had learned was if you aren't, as Jake was saying, if you aren't able to build that rapport with the patient, then you're not going to sort of get anywhere. So initially we kind of made a grand plan of changing medications and doing this and that. But we went in realizing that we actually have to sit and listen to get some buy-in before we can then give some suggestions. And I think what tends to happen is if we have this big plan going in and we kind of just throw things at the situation, the patient feels like we aren't listening and we don't understand because we aren't listening. We're just talking. And so they feel like we don't understand them. And then they kind of just shut off, as anyone would. If nobody's listening to you, you're not going to respond as such. And so it's actually valuable. And I think it's actually time saving in a sense if you spend that time listening initially, and then you'll get the patient buy-in and you'll be able to make suggestions that will actually work and the patient will actually be more compliant with.
All right, we've got to pause here on that great note. Thank you all for being here. If you'd like to hang tight and stay on for the last telecollaboration presentation, feel free to stick around. Or if you'd like, feel free to jump onto one of the other tracks to view another presentation.
Thank you all.
And if you're just joining us now, here we have a quote from one of our UNE alumni speaking about their experience at UNE learning about IPE. And our next presentation is the impact of interprofessional team immersion on a patient with long-term COVID. And we have several students here. And if anyone from this team is with us, feel free to give a wave. I'm Michelle Cody with CECE at UNE. And I also have with me Sarah Garber from Rosalind Franklin University as our all-star facilitator. Here's the presentation.
Okay, so today we'll be talking about the impact of interprofessional team immersion on a patient with long-term COVID. So we've all heard about COVID by now, but long-term COVID seems to be something that is a lot newer to us. It's basically defined as any patient who reports continued symptoms for at least 4 weeks after receiving a COVID diagnosis. Patients can range from those who had really severe symptoms to those who had mild symptoms. So we worked with different professions to basically discover more about long COVID via telehealth.
So our patient is Amanda. She's a 39-year-old female who contracted COVID-19. She was in hospital for about 6 days, and 6 months after the fact that she was admitted, she was having symptoms of just long-term COVID. Her worst symptoms is a migraine headache that just wouldn't go away. And her goal is to be free of migraine and to interact with the family again.
During this time as a team, we did a diverse knowledge of skills. We listened to different perspectives from different team members. And our goal was towards patient's need and patient-centered care and collaboration to make sure a patient is safe.
An advantage as a physical therapy student to this IP team immersion thing is that the patient's symptoms is unbiased. She appears how she is. And the disadvantage is that I was unable to get my hands on her or have her do some tests that I deem unsafe if she doesn't have a professional with her.
Advantages of being a PA student during this project is that I got to see how advantageous telehealth is for a patient who isn't feeling well and that they don't have to make the extra trip to the clinic. Disadvantage is that with PA surrounding a patient report so much, it can be hard to establish this over a computer screen.
An advantage of telehealth and occupational therapy is the flexibility it provides. For example, as Hannah said, it enables the patient to stay in the comfort of their own home and they don't have to travel very far. A disadvantage, I found it to be a challenge in building rapport, just because it's difficulty to pick up those nonverbal cues.
And an advantage as a pharmacy student during the telehealth is there's easy communication with patient and patient is convenient wherever they are. And a disadvantage is there's misinterpretation and miscommunication sometimes to interpretation of words.
As a DO student, some of the advantages that I've noticed are when working with an interprofessional team, it allows for efficient transitions of care throughout the patient's course of treatment, and it also utilizes a shared decision-making model, which helps patients' outcome. And the disadvantages are that you lose some of the body language cues that you might pick up in person over Zoom, and you lose out on the ability to use such things as empathetic touches on a shoulder to help comfort the patient.
What we learned from this experience was how to collaborate with other professions, how to effectively utilize telehealth and interact with patients and clients via telehealth. And that included being able to properly communicate with the client and in the best interest of their needs.
Some of the things that we would have done differently include better communication between sessions and make sure the patient has a good follow-up plan and make sure they're meeting all their treatment goals.
We want to thank Mary and Z for being our supervisors during this experience, and we really learned a lot. And we want to thank CECE for letting us be a part of this team immersion.
All right, we've got an attendance form for everybody to complete at the end of this, but first I'll pop it over to Sarah Garber to see if any questions sprang up from this, if you want to go over with any of the teammates.
Okay, thank you. That was a nice way to present things with pros and cons. And I'm wondering, I think you already answered this in the presentation, but how would you, because many of us feel that telehealth is going to become more and more a part of professional practice. So taking care of some of the cons and addressing those challenges is going to be becoming more and more part of our job. Given this experience, how do you think you're going to address those challenges in your practice?
I think it might be something that we'll just have to get used to. I know when we talked with the client actors after the second session, that's what they told us. They said it's just going to become more of a thing, and you have to kind of find a way to connect with your client via telehealth. And they also recommended, getting closer to the screen as a way to maybe facilitate that closer interaction.
I could just piggyback off of that. I would just add that the logistics of telehealth when it comes to the internet connection and the older population being able to navigate the communication through the computer or whatever interface you're using, I think that's the major limiting factor. It's obviously not ideal if to do a physical exam, then you can't do a physical exam, but it allows a lot more patient encounters that maybe you wouldn't have seen the patient because of X, Y, and Z. So I think it is a good thing in the future, but the interface and just making sure everyone has the same internet connectivity could be the limiting factor.
Yes, those are good insights and very good points. How did it affect your ability to work as a team?
Just a little piggyback about this. Can everyone hear me? I don't know. So it's mainly communication. Like the way we did it, we share our emails and we're able to communicate via emails, and that's how we kept in touch with each other. And via Zoom, that's the best way to communicate.
I feel as though we were able to communicate pretty well, even though we were all on Zoom. I think maybe if we had a longer length of time to discuss, like between simulation sessions, it may have made a big difference in helping our client. But I did find that we were each able to share our ideas well, even though we were all in separate places.
Thank you. How would you, or what's the bottom line? What are you going to take forward in your professional practice for you? That's any of you who'd like to respond.
I think with telehealth, it's really showed how technology has really advanced, just because before COVID or many years before that, telehealth wasn't something that people thought could happen in healthcare. It just seemed like such a foreign concept. So I think that definitely it'll be more advanced in the future, and maybe it'll make up for some things that we didn't think was possible before.
And with that, I think it's time to put the attendance slide up. Thank you all so much for sharing your presentation. Great work, everybody. I'm going to now share my screen once more so that we can have the attendance up for you all.
Thank you, everyone. Great job, Michelle.
Thank you, Sarah, so much for all of your help. Thanks for all of your great work today.